So, what can be done to help fight childhood obesity, especially when it comes to minorities? Earlier, I spoke to Sally Squires, the Director of Food and Wellness at Weber Shandwick, Public Relations. I asked her why minorities are seeing such a sharp rise in obesity rates.
Well, there are really four reasons that Hispanic children are overweight, and this is from the Robert Wood Johnson Foundation, which looks at this issue very closely. So we know, for example, that they don't have as much access as other children to healthy foods that tend to be high in nutrients and lower in calories. They also watch more television than their counterparts. And it appears that they're not as physically active. And there's a really good reason for that. And that's that their parents often express safety concerns about letting their children go out to playgrounds or play in the backyard. So they tend to live in areas where their parents feel like they should stay indoors rather than be active outside.
Right, when you talk about access to food, is it the fact that there is a shortage of food, or is it food that is nutritionally not very good?
It's really a combination of both. So we know that people who are living in urban centers, especially, what the First Lady has called places that have food deserts, they don't have access to healthy markets or fresh fruit and vegetables as much as other people do. So it's partly that, and then it's partly appears to be cultural. It's what foods are preferred, and that there tends to be kind of a preference towards some of these higher fat, higher calorie foods that have been culturally learned, especially in the U.S. Yes, high carbs and also high fat.
Do we have any numbers? Can we put a number to this in terms of the percentage of kids that are obese right now?
Yes, we can. And so we know that about 18% of kids are now obese, which is a staggering number. And that's staggering for a couple of reasons. Because if you're obese as a child, you don't usually grow out of that as people used to think. So those are kids who are likely to be obese as teens and then as adults. And that means that then they're at increased risk for a host of problems, and that's type 2 diabetes, heart disease, high blood pressure, even cancer.
What is being done to counter this?
Well, here's the good news, and I think we can really thank First Lady Michelle Obama for raising this problem to really the national dialogue. So her Let's Move program has really helped us know as a community, as a country, and really worldwide, we have to address this program. She's also been, this summer, she was actually the keynote speaker at a major gathering of Hispanic and Latino community people in New Orleans, where she also kind of raised the alarm that this is a topic that they have to address as well.
Is it working?
It is working, and so there are some, and we know that from the latest numbers that have come out from the federal government. So for the first time in decades, we're actually seeing childhood obesity rates not only level off, but actually drop a little bit. So that's really wonderful. And we also know that programs like Healthy Chicas are exactly the kind of program where the entire family gets involved. Years ago, I wrote a book about this, the Stoplight Diet for Children, and it was based on National Institutes of Health research. One of the key points was that when families address this together, they're much more likely to be successful.
Right, and obesity itself is a problem, we know that, but it also leads to other problems. I mean, you alluded to it just a moment ago when you said that children can develop diabetes, for instance, but that could lead to a whole host of other diseases.
That's right, and we know actually that diabetes, which we never used to see, this adult onset diabetes, what's known as type 2, and it's very much weight related. We never used to see that in kids. And now we see it in children as young as 8. And that means that they are at risk for all kinds of health problems. And heart disease is one of those, but blindness, limb loss, all kinds of things.
Sally Squires, thanks for joining us.
Thank you for having me.